You're exhausted but can't sleep. You snap at everyone and you're craving carbs like your life depends on it. You think it's just stress, or hormones, or maybe you're just not handling life as well as you used to. But this could be warning signs. Your body's screaming at you, and most women ignore this until they crash. Today, I'm breaking down 5 silent stress symptoms that show up before burnout. And number 4, it's one you're most likely struggling with right now. And I'll be discussing natural ways to manage these. Hi, I'm Dr. A. I'm an integrative psychiatrist and lifestyle physician. Let's start with the first silent symptom, and it's one you've probably felt this week. Number 1, wired but tired. You're exhausted all day, but the second your head hits the pillow, your brain won't shut off. You lie there, replaying conversations, making mental to-do lists, worrying about things you can't control. Your racing thoughts are driving you up the wall, but there's not much you can do about it. Here's what's happening. Your stress hormones are hijacking your sleep-wake cycle. Chronic stress disrupts your HPA axis. That's your body's stress control center. Your cortisol stays elevated when it should drop at night. Your nervous system gets stuck in fight or flight mode. A study found that women in perimenopause with chronic stress have significantly disrupted cortisol rhythms. Translation: your body has forgotten how to relax. And when you can't sleep, everything else falls apart. Your mood crashes, your focus disappears, your patience evaporates, your anxiety skyrockets. Unfortunately, this is just the beginning. It contributes to other symptoms like number 2, losing tolerance. You used to be patient, understanding, the calm one in the room. Now the smallest thing sets you off. Your partner chews too loudly. Your co-worker's email tone feels passive-aggressive. Your kids asking what's for dinner makes you want to scream. You feel guilty. You think, what's wrong with me? Nothing is wrong with you. Your stress bucket is overflowing. Research shows that chronic stress reduces your capacity for emotional regulation. Your prefrontal cortex, the part of your brain that keeps you calm, gets overwhelmed. Your amygdala, your emotional alarm system, takes over. You're not weak. You're overloaded. And if you're noticing this, there's something even more concerning happening inside your body right now. If you're finding value in this video, subscribe to this channel so you don't miss future content that could change your health. Number 3, craving carbs and sugar like crazy. You're not hungry, but you need something sweet or salty or both. You tell yourself you'll just have 1 cookie, then you eat 5, and you still want more. This isn't just a willpower problem. It could be related to cortisol. When you're chronically stressed, your body craves quick energy. Cortisol drives you toward high-calorie comfort foods. A study found that women under chronic stress consume significantly more sugar and refined carbs. Your brain is trying to soothe itself, but those blood sugar spikes and crashes, they're making your stress worse. And speaking of your brain, there's a symptom that affects your thinking that most women brush off as just getting older. Number 4, brain fog. You walk into a room and forget why you're there. You lose your keys 3 times a day. You can't remember the word you're looking for mid-sentence. You joke about it. Mommy brain, senior moment. But this isn't normal aging. It could be stress-induced cognitive impairment. Chronic stress floods your brain with cortisol. Over time, this can damage your hippocampus, the memory center of your brain. Research shows that prolonged stress actually shrinks this area. Your brain isn't broken, it's drowning in stress hormones. And there's one more symptom that ties all of this together. Number 5, anxiety and irritability. You feel on edge, restless, like something bad is about to happen, but you don't know what. You're irritable with everyone. You feel guilty about it, but you can't seem to stop. Here's the truth. Anxiety and irritability are your body's way of saying, I can't take anymore. Studies show that women in perimenopause are at significantly higher risk for anxiety disorders. The hormonal shifts combined with chronic stress create a perfect storm. Your nervous system is stuck in overdrive and is affecting every area of your life. So what do you do about it? First, recognize the symptoms for what they are, warning signs, not weaknesses. Second, support your stress response with adaptogens like ashwagandha and L-theanine. These help regulate cortisol and calm your nervous system. Third, prioritize sleep. Even 20 minutes earlier to bed can make a difference. Fourth, move your body. Even a 10-minute walk lowers cortisol and boosts mood. And fifth, get support. Whether that's therapy, coaching, or a trusted friend, you don't have to do this alone. And talking about adaptogens like ashwagandha and rhodiola, check out this next video which explains how and when to use them.